So you woke up one day with some of the worst shoulder pain you've ever experienced in your life, and you don't have a mechanism of injury. You're a woman who is in perimenopause, and now you can't lift up your arm, you can't fasten your bra, you can't brush your hair. Do you think you have frozen shoulder? Well, maybe. There are two types of frozen shoulder, primary and secondary. It's also called adhesive capsulitis. Primary frozen shoulder comes on when generally there is some kind of chemical imbalance. Let's think thyroid, your diabetes isn't managed, you're in perimenopause or the menopause transition, and the capsule of the shoulder starts to shrinking down and become fibrotic and tight. So there is a thickening on the front part, specifically the coracohumeral ligament will actually get a thickening. The coracohumeral ligament has the bicep, the long head of the bicep that runs underneath it. This is why the front part of the shoulder hurts so bad and there's referral pain down the bicep, but it oftentimes comes on with no mechanism of injury, no fall, and usually a chemical component. Now, secondary frozen shoulder is different. Secondary frozen shoulder comes on after, let's say, surgery, you were immobilized, and then the way your shoulder is remodeling is haphazard and it's a little bit more fibrotic. Then you didn't move it because you were in a sling. So that is secondary frozen shoulder. Or maybe you have an undiagnosed rotator cuff tear and that's why your shoulder's not letting you move. But primary frozen shoulder is what I'm talking about right now, especially if you are a woman in the menopause transition. Now, because frozen shoulder is a tightening and a stiffening of the capsule, which thinks saran wrap of the shoulder, there is a thickening happening on the front. And so with that, your external rotation going out is limited, abduction going up, and internal rotation. You basically get this little frozen chicken wing and you are in so much pain. There are three phases: freezing, frozen, thawing. Freezing is the initial stage, horrible. Frozen, well, it doesn't hurt too bad. You're not moving it all that much. The range of motion is pretty stable. And then thawing, your motion's starting to come back, but you still hurt like the dickens. As a women's health physical therapist, here is what I recommend to all people based on the research. And remember, I'm a physical therapist, but I'm not your physical therapist. This is just educational material, okay? Number one, you need to go to your primary care doctor. Research shows that primary care doctors are very good at managing frozen shoulder. Number two, what will happen? Your primary care doc will do blood work to make sure your thyroid is okay, your blood sugar is okay, and that if you are in menopause, is this the time you finally start taking hormones? Because there is research out of Duke coming from Jocelyn Whitstein, the patron saint of frozen shoulder, saying that, hey, this might be related to the menopause transition. And I'm going to tell you the reason why is because you have estrogen receptors in your shoulder. Okay, there is estrogen receptors in the tendons of your rotator cuff. Now, true, I was talking about your capsule. Your capsule and rotator cuff are different, but do know that your connective tissue is very much impacted by what's happening chemically in your body. So when you go through the menopause transition, things are not very well hydrated, things aren't moving, and even your shoulder will take a hit. This is why you have so much widespread tendonitis. So the next thing people do when they have frozen shoulder, you talk with your doctor, they might order blood work, you may be referred to an orthopedic surgeon or a physical therapist. If they suspect that there is an underlying injury, such as the rotator cuff tear, bicep tendon, they might actually do diagnostic imaging, but not usually. That is not normally the case. They may refer you to physical therapy so that you can learn some exercises to gently warm your joint and get some range of motion. And they may prescribe medication. And if they do, glorious, good. They may talk to you about wanting to take hormones. If they do, I think that sounds glorious. But if I were to tell you how long frozen shoulder takes to resolve, it's months, many months, 9, 12, 36 months, years. There is spontaneous healing if you did nothing, but why would you want to not facilitate the healing process? So please, if frozen shoulder sounds like you, please talk to your doctor and see what you can do.